has been 10 years in the making, and it's super exciting to be here. And I think of much of the services that community care provides continues to still be out in the community with our Meals on Wheels, our transportation, our adult day programs. We still have our hospice services. But what is found here at our Community Health Center at 21 Angeline Street North is our primary care team, our geriatric team, our dental services, and our wellness supports, as well as some of our admin team. So what we've done is brought together a variety of teams who used to be under independent roofs, all under one roof here at the Community Health Center to make sure that we're positioned to meet the needs of the community and offer a better client experience, because now someone could come to their doctor, walk down the hall, and go to their dentist. Or they could come to their dietitian, walk down the hall, and go to a cooking program that dietitian is offering later in the afternoon. These are things we could never do before, and we look forward to finding opportunities to strengthen and improve our care for the community of Kawartha Lakes. Our Community Health Center has two teams that I'm going to talk about right now, is our GAIN team and our primary care team. So our primary care team belongs to a network of community health centers across the province who embody a model where we believe that health doesn't necessarily start in the four walls of a clinic like ours, but where you work and where you live and where you play. But within our walls, we have doctors, nurse practitioners, and then an interdisciplinary team of social workers, dietitian, nurses that all wrap care around our clients. And we complement that with some of the wellness programs that we offer to try to promote health and keep people living with optimal mental health and physical health. We also have our GAIN team, which is our geriatric assessment and intervention network. And our GAIN team is a specialty geriatric clinic where they do full comprehensive assessments, geriatric assessments on individuals to assess them for their medication, their frailty scores, fall risk, and things along that line. And what they do through a team of, again, a nurse practitioner, a geriatrician, client support workers, pharmacists, is they make sure that our clients are well positioned to navigate their senior years and remain independent at home for as long as possible.
Okay, Ryan, so tell me a little bit more about the Community Dental Clinic.
So our Community Care Dental Clinic is here to try to make oral health care more accessible for people living in our community. Oftentimes we know that people are deciding between, am I going to get dental care, or am I going to pay a hydro bill or put food on my table? And our dental clinic is trying to make oral health care a more accessible option for people living in our community who might not have dental benefits or where dental care might otherwise be out of reach. And we're grateful to have a free operatory dental clinic here in our building at 21 Angeline Street. It's ready to serve the community.
And what kinds of treatments can people have here?
I would say that when you think of oral health care and going to the dentist, all of the items that are typically offered at a dental clinic, as you can see in our operatory here, are offered to our clients. So, cleanings, fillings, things along that line. And our denture work is done out of house, but otherwise it's done here in our office. So the multi-purpose room is, for me, one of the most exciting parts of the new building, because it's the first time that community care has had a space of its own to offer programming out of that allows us the flexibility to do many different things. For example, today there's some sewing going on in the multi-purpose room, and behind me you can see that there's a full teaching kitchen, which allows our dietitian to not only give counseling to people in a counseling room, but they can also come out and actually do some cooking classes to learn how to prepare a healthy meal on a budget or what have you. So really the opportunities are endless in this room for us. We now have a space to be a little bit more flexible and creative with meeting some of the needs that we have.